will just kick it off with a very, very simple and common concern that parents have, that every time their kid has joint pain, they think that it would be due to arthritis. Or in arthritis, the child will always present with joint pain. And if the child has never complained of pain, it is unlikely to be arthritis. Okay, so this in itself, joint pain is always equals to arthritis, is a little bit of a myth, and I'll go through why. As not all joint pains are due to arthritis. Actually, interestingly, even though all of you here in this talk have a child or a relative or a friend that you know of with JIA, which is juvenile idiopathic arthritis, it actually is not as common as other conditions, such as overuse syndrome, growing pains, hypermobile joints, transient synovitis, and reactive arthritis. These are the more common causes of joint pains in children, as JIA occurs only in 1 in 1,000 children. So for example, I mean, in Singapore, we have about 30,000 new babies born every year. So we would be expecting approximately 30 new diagnosed new JIA cases every year. And in itself, that is actually not very, very common. Most of the time when a child complains of joint pain, what we can do is to monitor and see if the pain persists even after resting overnight and over the next 3 to 4 days. If by the 5th day they're still complaining of pain, then it may be worthwhile bringing the child for an examination by the doctor. The other thing we need to know is that not all arthritis present with joint pain, because they can also have symptoms like limping or difficulty using that limb. So the child may not complain of pain at all. They just limp and adapt their movements to it. They could present with stiffness of the joint, such as when after prolonged periods of being sedentary, such as when waking up in the morning, or after a long car ride, or after a long period of sitting around in the classroom. Joint swelling is also another symptom, as well as warmth over the joint and redness of the skin over that particular joint. Some children actually present with symptoms outside the joint. Typically, this happens in children with the subset called systemic JIA, where they would have fever, rash, swollen lymph nodes, swollen liver, and spleen. Majority of children with JIA do not have fever. So if they do have fever, rash, swollen lymph nodes, then the consideration would be that they may have the systemic JIA form. So here, the joint pain is equals to arthritis. The myth is busted. It is not equivalent. Whenever your child complains of joint pain, do look into whether the child has stiffness also, joint swelling, warmth, redness, or difficulty moving that part. And if this persists for more than 5 days, then you would need to bring your child to your doctor, your pediatric rheumatologist, to have your child examined to determine if there is a flare of arthritis. Otherwise, majority of the time is your child probably not using the muscle correctly, or have overused that joint, for example, on a particularly active day, such as a day where they have PE lessons.